Hello everyone, welcome back to my YouTube channel. Today we are going to talk about Vomer. We will start our topic with introduction and here is diagrammatic representation of Vomer. Vomer is a thin, flat, unpaired bone. That means there will be only one bone in every skull and it is located in mid-sagittal plane of the skull. It forms the posterior inferior portion of the nasal septum, playing a crucial role in dividing the nasal cavity. The bomber consists of several distinct features. The first is surfaces, borders, and we will talk about surfaces and then we will talk about borders. The surfaces of bomber are lateral surface. Each surface contains the nasopalatine groove which allow passage for nasopalatine nerve and vessel. And it also has medial surface that form part of nasal septum. Now let's talk about the borders of the vomer. The first border is the superior border. The superior border of vomer articulates with sphenoid bone and features the ally of vomer. And it has inferior border and inferior border of vomer connects with the maxilla and palatine bones. And it has anterior border that joins the perpendicular plate of ethmoid bone and the nasal septal cartilage. And it has posterior border that is free and does not articulate with any bones separating the posterior nasal aperture that is called as coni. And that's the reason norma basalis when we can see the ethmoid bone that forms the posterior nasal aperture and it is the posterior border of the vomer bone. Now let's talk about the functions of vomer. Nasal cavity division. Nasal cavity, it forms the lower part of the nasal septum, aiding in airflow regulation, and that's how it divides the nasal cavity. The second function of vomer is structural support, as it provides stability to the nasal cavity. And the third function is passage for neurovascular structure, as it contains grooves for nerves and blood vessels. Now let's talk about the clinical significance of the vomer. The first significance is deviated nasal symptom, as misalignment of the vomer can lead to the breathing difficulties. The second significance is fractures, as trauma to the vomer can impact nasal function. And the third significance is surgical importance, as it is often involved in procedure correcting nasal septum deviations. Now let's talk about the conclusion of this video. The vomer is a vital component of the facial skeleton, contributing to the nasal structure and function. Understanding its anatomy and clinical relevance is essential for medical studies and healthcare application. So this was all about vomer. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.